Hello beautiful people. In today's video we're going to talk about ulcer. We're going to talk about what ulcer is, what causes ulcer, the symptoms of ulcer, the preventive measures, as well as the treatment of ulcer. Okay, my name is Amara Ozadigwe. I'm a registered nurse midwife practicing in Nigeria, and I use this platform to share things about myself and health-wise, as well as how to cook, because I love to cook. So ulcer is deep wound that you find in the stomach or in the first part of the intestine, which is known as the duodenum. So what are the types of ulcer? We have peptic ulcer. This is the type of ulcer that occurs inside your stomach. We have the duodenal ulcer, which occurs at the first part of the intestine, and this one is often the most common. Duodenal ulcer is the most common type of ulcer that you see in people. Now, how do you identify which one is peptic ulcer and which one is duodenal ulcer? So in peptic ulcer, how you identify it is when you eat, the pain becomes much. That is, a patient that is suffering from peptic ulcer tends to feel more pain after eating, whereas someone who is suffering from duodenal ulcer tends to have a relief of the pain after eating. Then how does ulcer develop? It occurs when there is a breakdown in the thick mucus that protects the stomach mucosa from the harsh effect of the gastric acid or other digestive juices that contains acid, which one of them is hydrochloric acid. So if there is any breakdown in this thing that is protecting the stomach, then a condition known as ulcer will develop. Just explain it in a layman language in a way that you're going to understand. For instance, look at this phone that I'm holding here. This phone has a case here, and the essence of this case, as we all know, is that this case serves as a form of protection to this phone. If this phone falls down, this case will prevent it from cracking. That is what we believe that it normally does. Now, if there's anything that will attack this case now, then you know that if it attacks this, that means the attack will now come into the phone itself. So this is exactly what happens in the stomach. The stomach lining is covered by thick mucus that covers it, and this layer produces bicarbonate and also mucus. They try to wave off the harsh effect of these acids, like I mentioned before. So let's say that this is your stomach. If there's any breakdown in the stomach lining, then it will not lead to affecting the inside of the stomach, leading to stomach ulcer. Now, what are the things that can cause the breakdown of this stomach mucosa layer? The first one is just like most people don't know that what many ulcer is being caused by bacterial infection. There is a bacteria known as Helicobacter pylori. This Helicobacter pylori is a bacteria that tends to attack this stomach lining, and because of how active this bacteria is, it produces some enzyme known as urase that helps it to protect itself from the harsh effect of the gastric juice. Then another one is the use of medications, and the most commonest medications that cause this is steroid or non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs are the drugs that most people use to relieve pain. Point is excess production of stomach acid, and this stomach acid is hydrochloric acid. What actually causes the excess production of this? You see smoking, stress, use of spicy food, use of excess caffeine. And another one is genetics. If it is in some families have been shown to show this, but it's not that general, because your mom or your dad have ulcer, that means you're going to develop that. No, that's not a fact they're going to develop, but it's a risk factor anyway. Then another one is some medical conditions. There are some medical conditions that will predispose you to this because of the medications that you take or other things that surround that, or problems that have to do with the stomach. So now I'm going to talk about the symptoms. So what are these symptoms? The first one is when you have pain. When you have abdominal pain, some people, their own pain may not be on the abdomen. Some guys do come up on the chest area. Then some other people feel this at their back just at their back. Then the second thing is nausea and vomiting. So if you experience nausea and vomiting, is another sign, and is a critical sign that people often look out for. Like people always do, or when they start vomiting, they will start looking for drugs. But nausea and vomiting is one of the classical signs. Then another symptom is what we call indigestion. You know that you ate and you found out that the food tends not to be digested. You see yourself bloating every time, and at most times food are supposed to digest. After some time, it will not digest. Then another sign or another symptom of this is what we call melena. Melena is a black stool, black tarry stool, a process by which you give you stool, and your stool is looking black. Your stool is black in color, and you know that you do not eat anything vegetable, or you do not take any iron medication, but you found out that your stool is black in nature. This is one of the clear signs. It may be that the stomach is already bleeding, so it will not make your stool to change from the normal color to becoming dark. Then some people, their stool may not really be that dark, but you have some stain of blood or fresh blood. Then another one is vomiting out blood. When you vomit and you vomit out blood. Another one is when you notice that each time you finish eating, that you start feeling pain. And sometimes when you know that you are having pain, but after eating the pain will stop, abdominal pain. So check this too. If you are having abdominal pain and once you eat it will stop, or you're having abdominal pain and once you eat it will be so much that you cannot bear it. There are some things that you have to do to be able to say that this is ulcer or that this is not ulcer. Why am I saying this? There are some people that may not show these signs and symptoms that I mentioned now. They may not show it, but they are having chronic ulcer, and before they will know it, such a patient will become anemic. Then that will also lead us to the next one, which is iron deficiency anemia. Some people, they notice that they are losing blood. You are losing blood, you are becoming whitish. Another one is when you have bloating, as in after eating you feel so full that you don't feel like eating. This one will also lead us to the kind of you don't want to eat, having the loss of appetite, because people that experience pain after eating, once they see food, they will start being fearful. They don't want to eat because they don't want to experience the kind of pain they have. So if you know that you are losing appetite because of pain, is another sign. So how are you going to know that actually that you have ulcer? Irrespective of the symptoms that I talked about, there are the various tests that you need to do to be able to say that what this patient is suffering from is ulcer or not. Now, one of them is a blood test known as flow test. Is in this test that they need to find out if you have H. pylori, and it's been done by withdrawing your blood, and the lab scientists know how to do that. And the second one that will actually show us if you have ulcer or not, or where the ulcer is located, is a procedure known as endoscopy. Endoscopy is a process of inserting a camera. There's a way they do it inside your stomach, and endoscopy helps to find out where the ulcer is, the position, the extent of this ulcer. Then another one is also the use of Barrett's test is through biopsy. There are some cases whereby the patient will present with severe symptoms, and when other tests are being done, they would like to do biopsy to rule out if this is not stomach ulcer, because people that have stomach ulcer can also share the signs that I talked about. So what are the treatment options for peptic ulcer? There is one, we have the use of medications. There are some medications used to treat ulcer. One is what we call the proton pump inhibitors. It has most of the drugs that people use. So this proton pump inhibitor, their function is to protect the stomach lining against the production of the hydrochloric acid. Then the second treatment option is the use of surgery. There are some cases whereby the patient will be booked for surgery. Then another one is you need to redo your endoscopy. Once you start your treatment, you need to go for frequent endoscopy to check if the stomach ulcer is actually healing or not. Then the final one that I'm going to talk about here is you need to stop abusing pain reliefs. There are some people that are just common headache. You see them, they will just go and buy pain relief, and not just that, they are taking it on empty stomach. So complications of ulcer, number one is bleeding from the ulcer, which can lead to anemia, and also it can also be life-threatening because when you lose a lot of blood, there is nothing that your system will. Then another thing that can develop from this is perforation. When the stomach lining continues to erode, it can reach to an instant whereby the stomach itself will be perforated, and this will now make all the gastric content, when you eat, it will enter into your peritoneum, causing a condition known as peritonitis. It can cause stricture on the lining of the stomach or scarring, and when there is scarring on the lining of the stomach, the way it affects the individual is when they eat, the food will not have enough space to stay for proper digestion to take place. Then the patient will tend to vomit, or the patient will tend to be so bloated up, or in some cases the already digested food will not see way to go into the small intestine because of the strictures that must have obstructed the sphincters that is between both the stomach and the small intestine, or the stomach and the esophagus, and also lead to what is called the pyloric stenosis. I've already talked about that. Is a way of constricting the sphincters that is between the two sphincters that connects the stomach to the intestine, or the stomach to the esophagus. If you ask me how to prevent stomach ulcer, the first way of prevention is, once you see symptoms, please present yourself to the hospital so that you will adequately stay at home to treat yourself, no matter how common the symptom may look like. I know I've talked for a long time now, and if you watch up to now, please just do one thing for me in this video. Click like the video, share the video, and also subscribe if you've not done that, and see you in our next video. Bye.